Alrighty, let's talk about a medication that we all know, something that we're all comfortable with. Let's talk about acetaminophen. All right, what is the trade name for acetaminophen? Most common one you're going to know is going to be Tylenol. What are we giving this for? We're giving it for pain and fever. Very common medication you're going to give in the ICU and the ED and the med-surg floor, wherever you work. Acetaminophen is something you're going to see and you're going to give very often. A lot of times for fever, you got a patient with a 101 fever, you can give them a little bit of Tylenol, help to bring that down. Also give them with pain. A lot of times it's used in conjunction with other medications for pain, like your Norco has. It can have 350 Tylenol, it can have 600 Tylenol, it can have different doses of Tylenol in there. How does it actually work? Okay, now we know what it does, we know why we give it, we're going to be giving it every single shift. How does it actually work? What it does, it actually inhibits the synthesis of prostaglandins. Okay, these prostaglandins actually play a role within our body in transmission of pain signals and fever response. They can also help with inflammation a little bit or play a role in it. So what we can do is we actually give this acetaminophen and that inhibits that synthesis. So if we're not able to synthesize and create these prostaglandins, that's going to help to prevent pain and fever from being transmitted. Its therapeutic class is antipyretic. What does that mean? Antipyretic means fever preventer, fever reducer, whatever. And it's also non-opioid analgesic, okay? So it can help with the pain without, the opiate side effects. But what are some things that we need to keep in mind for a patient taking acetaminophen? First and foremost, biggest one I want you to keep in mind is that we should never exceed 4 grams of acetaminophen per day, and that helps to reduce and limit the risk of liver, renal, and cardiac damage. One of the big things we're looking at here is going to be liver damage, and they've actually been studies that possibly it's even a little bit less than that, but what we go with here is we go with our 4-gram maximum limit. That sounds like a lot, right? Because we're giving it in doses of 300 or 600 or 700, but if you give enough of it, and if your patient is on like Norco, it can be very easy for them to very quickly get to their maximum. Okay, if they're taking Norco 350 and 10 every 4 hours, it can be very quick, within a 24-hour period, that they're going to hit their maximum dose of acetaminophen. So you kind of have to let your patients know that too when you're planning that, or hopefully there's some sort of adjunct medication on there too, maybe some morphine, a milligram of morphine you can mix in with this and kind of alternate that so that every time you're giving pain medicine, you're not giving the Norco and every single time. And then you can limit that. Maybe you can shave some of the edge off the pain with milligram morphine and then intersperse that with some Norco, so you can kind of skip maybe one of those 4-hour doses, PRN doses, so that your patient's not hitting that maximum and causing that liver damage. Overdose will lead to this hepatotoxicity. You see, if you've worked in a hospital long enough, you've definitely seen a patient come in with Tylenol overdose. It is not pretty. I know that sounds like it seems kind of crazy that household medication could cause these problems, but if you ever see a patient take an entire bottle of Tylenol, it's very not pretty. They're going to end up in the ICU. They're going to be there for quite a while. They're going to cause this massive liver damage, and they'll end up being intubated. They're going to have to pump the stomach. It's just very not pretty, okay? The antidote for this, if a patient does overdose, if you work in an ED or you work in a ambulance, the antidote for this is Acetadote, Acetadote. One other thing, or a couple other things you want to keep in mind with this as well, is that it may increase the risk for bleeding with warfarin therapy. Okay, so if we're already giving our warfarin, our Coumadin, adding some Tylenol to that can actually increase our risk of bleeding for those patients. And it can also alter blood glucose. This has been another episode of the Nursing.com MedMaster Podcast. My name is John Haas, RN, CCRN alumnus, and I want to give you our free download of the 50 most commonly prescribed medications. To get that free download, just go to nursing.com/50meds. That's 50, nursing.com/50meds. We love you guys. We want you to succeed. That's why we provide clear, concise, and visual supplement for nursing school and the clinical floor. We love you guys. Go out and be your best selves. Happy nursing.